Hey, it's Anthony Selm with Medicare Easy Street, and in this video we're going to talk about the difference between Medicare Supplement and Medicare Advantage. And as a senior, you probably get overwhelmed with options. I mean, there could be 20 to 30 different Medicare Advantage plans, dozens of insurance companies offering Medicare supplements, 10 or 20 or more Part D drug plans. So it's easy to get bogged down, but we're going to go through the differences, the fundamental differences, so that hopefully it helps you streamline the decision-making process based on what's important for you. Let's dive in. All right, so if you're new to Medicare, then one of the first things that you will want to cover, or that I cover with all my clients, is the two options that you have on ways to receive your health care benefits while you're eligible for Medicare during retirement. And option one, here on the left, is going to be the traditional route. That would be considered the gold standard, which is what most people do when they can afford it, which is having original Medicare with a Medicare supplement and a Part D, standalone Part D prescription plan. Then option two would be opting into a privatized Medicare Advantage plan, Medicare Part C, and letting the insurance company administer all those benefits. So what are the differences? Well, let's start back with option one. So first, understanding that with original Medicare, Part A and B administering those primary benefits, that gets you access to any healthcare provider nationwide that accepts Medicare. So that's one of the big pros, is with the option one is the freedom and flexibility and lower out-of-pocket cost when you use your healthcare, when you go to the doctor or if you're in the hospital. So Medicare, original Medicare as the primary, that's the big ticket there, is getting access to any provider without any network restrictions. So there's really not any networks in a traditional sense. The doctor accepts Medicare, you can go to them. It doesn't matter what state they are located in or you are located in. Then with the Medicare supplement plans, you can customize that based on the type of benefits you're looking for and filling in those gaps that are left over by original Medicare. Most of those plans fill all or most of the gaps. So at least the popular plans do. So there you're going to have a monthly premium in addition to your premiums for Medicare, but you're not really going to have much, if at all, any out-of-pocket cost at the doctor or hospital. If you had some major surgery, knee replacement, it's going to be taken care of. Heart surgery, cancer treatment, it's all going to be paid for. You're going to pay those higher monthly premiums for the Medicare supplement insurance, but not really have to worry about any other additional cost out of pocket. So it creates more of a stable year-to-year budget, whether it's a good or bad year. Then with the drug coverage, in option one, you can custom tailor that based on the medications you're taking. The Part D prescription coverage would be a standalone plan on its own, so you can look at your drug list and see how that matches up to the plans that are available in your area. In most areas, you're going to see at least 15, maybe to 20 different drug plans, so you can really dive down into the details of those and custom tailor that piece to your liking. So on the other side, with Medicare Advantage, we have to think of Medicare Advantage as the equivalent to original Medicare, but privatized. So it's administered by a private insurance company, which means you no longer receive your benefits from the government, from original Medicare. When you opt into a Medicare Advantage plan, that takes place of your original Medicare benefits. They also call it Medicare replacement. In that you have to abide by the rules set forth by the insurance company. So if it's an HMO network or a PPO network, typically those are the most popular, but there's cost plans and PFFS plans and many different options there with Medicare Advantage. But for the most part, HMO and PPO are the two popular options. Just knowing that you're not going to have access to all the providers nationwide that accept Medicare, you'll still have access to healthcare providers probably locally in your area. And with HMO plans, that's one of the big trade-offs there, is usually they can offer that at zero premium. So you still are going to pay your premium for Medicare Part B. Usually Part A is free, but you pay your premium for Part B. But in addition to that, some of these Medicare Advantage plans can offer zero premiums. Those are typically the HMO style network, where if you're out of network on an HMO plan, for example, you're on your own. So unless it's an emergency, then you're going to foot the bill for the entire cost, and the insurance companies doesn't have to cover anything if you're out of the network. So Medicare Advantage, again, still good coverage. You just have to know the limitations and know what you're getting into there so that you don't end up with a surprise later on. And also with those plans, the drug coverage is typically built in. So you want to make sure not only your doctors are in the network, but that your prescriptions are covered appropriately with that specific plan. We find that all the time where someone finds a plan that they like because it covers their doctors, only to find out that one of their prescriptions isn't on the formulary, so we got to start the search all over again. So again, not bad. Think of it like the silver level coverage. It has some limitations. You have to keep an eye on that and check on it every year just to make sure there's no changes that could adversely affect you and your benefits. So when we look at how we're going to get those benefits, let's first take a look at Medicare supplement insurance. So when we think of Medicare supplement Medigap, it is designed alongside original Medicare, and it's designed to fill those gaps in depending on which plan you choose. But those, again, have no network, so you can choose any Medicare participating doctor. Companies can't single you out for rate increases, unlike your auto or homeowners insurance, where a company, if you get into an accident or have a fire or a claim on your house, they can raise your rates or drop you. That can't happen with Medicare supplement. They can't single you out because of your health. The benefits are standardized. We're going to look at that here in just a second, but just know that really they are apples to apples. It doesn't matter which company you choose. The benefits are set at the government level. The claims process is very simple because it works alongside Medicare, and Medicare, the primary coverage, is the gatekeeper. So as soon as Medicare approves a claim, the insurance company just fills in that gap automatically. There's no approval or denial on claims at the insurance company. That's all set forth at the Medicare level, so you don't have to worry about an insurance company denying a claim. If Medicare approves it, they have to pay their share. Coverage is nationwide, not just in your state. Any Medicare approved doctor anywhere in the country, so it travels with you if you're traveling. The coverage is guaranteed renewable, so that means that you can't be dropped if you end up getting sick, and as long as you continue paying the premiums, then you're going to be able to keep that coverage for forever. But you will see rate increases. So these plans have rate increases based on age in most states, at least, where you're going to see a small rate increase each year. And you can identify the companies that have a good history there when you're selecting your Medicare supplement, so that we can't predict the future, but at least we try to look at the carriers that have a good past to look back on. So those plans with Medicare supplement, if there's one part of this video that I want to stick with you, is that with Medicare supplement, Medigap insurance, there isn't a yearly open enrollment period. A lot of people confuse that. With Medicare supplements, there's a one-time open enrollment period, and that's for the first 6 months you start Medicare Part B, or you're turning 65 or leaving your group insurance. So during that first 6 months, you have a guarantee insurability period where companies have to accept you regardless of your health status, and you can choose any Medicare supplement from any carrier you wish. After that 6-month period is up, though, they can deny coverage altogether based on the answers to their health questions. Each company is different. Don't let that scare you, but chronic illnesses like COPD, diabetes with insulin use, cancer, heart disease, things like that can prevent someone from being eligible for a Medicare supplement plan, depending on which state and which insurance companies are offered. So these plans, if you are looking at Medicare supplement insurance or considering it, now's the time, because you don't have to answer any health questions, which means the enrollment process is very easy. You can start the process 3 to 4 months ahead of time. Most companies will let you lock in a price as early as 6 months out. So, for example, if today were July 1st, you could theoretically apply for coverage starting January 1st. Companies will let you lock in that price 6 months ahead of your start date. And then just a couple bullet points here. If you're on COBRA and you're 65, you'll want to give us a call or talk to a specialist, because those benefits are not considered creditable in the eyes of Medicare, even though it is group insurance coverage. COBRA is not considered credible, so you want to go ahead and get a phone call so that we can look at that for you. Same thing if you're with a small company with 19 or less employees. In most states, you're usually going to have some penalties if you delay enrolling into Medicare, because you're still going to be covered by that group plan. So you want to go ahead and give us a call if you're in either of those situations. So let's look at the Medicare supplement plans. I took this chart right out of the government Medicare handbook. These are the 10 Medicare supplement plans. So if there's one thing here to notice, is that there's no company names on this page. There's just letters. So you'll see the 10 letters: A, B, C, D, F, G, K, L, M, and N, and there's a high deductible version of Plan F. But Those are the 10 standardized plans. And in most states, except for Minnesota, Wisconsin, a few other states that are unique, these plans are sold by a letter. So it doesn't matter which company you're with that sells Plan F or G or N. Those are the 3 most popular. The benefits are going to be exactly the same. So you know you're getting an apples to apples comparison when we look at the pricing. So you can see, for example, Plan F, one of the most popular plans now for many years. Usually it's overpriced, but we'll see that in just a second, that it covers 100% of the gaps left by Medicare. So theoretically, you have Plan F, you have original Medicare. Anytime you go to the doctor, it's covered 100%. Anytime you go to the hospital, surgery, physical therapy, whatever happens, as long as Medicare approves that claim, it's going to be covered 100%. Plan G, the next step down from F, benefit-wise, is only missing one piece, which is that Part B deductible. And you can see that's the only box that's missing. Plan G, usually the difference in cost more than makes up the difference in benefits. So with the Part B deductible, at least as of this recording in 2017, that deductible is $183 once per year. Once it's paid, then you have 100% coverage with Medicare Supplement Plan G. And then with Plan N, the next step down from G, think of it like G's little brother or little sister. You have some copays for doctor's visits, and you also pay the deductible. But in addition to that, you could pay excess charges. So depending on where you live, like here in Ohio, it's a mom state, Medicare overcharge measure, where they don't allow excess charges. But a lot of states do. So if you're traveling, you want to keep an eye on that so you don't get a surprise with an excess charge. And we can help you look at the difference there in price to see whether G or N makes sense depending on what your budget is. There's not a one-size-fits-all solution, but we want to try to look at the plans that are going to provide the best value in the long run, which is why we look at the comparison of these companies. And you see here from this chart, they're an apples-to-apples comparison. So the pricing, and these are actual prices that I pulled up from here in Ohio, but it's different from state to state depending on where you live. But the premiums can vary greatly. I mean, you can see in this chart, the lowest price plan was $106. The most expensive plan was $218. Same exact benefits across the board. There's no difference whatsoever other than the brand name of the company and the price that you're paying each month. But some other things to look for is the company rating. What's their financial stability? What's their rate increase history? How many years in the market have they been operating in your particular state? What's their experience there? We can't predict the future, but we can look at least and try to find some carriers that have a stable track record so that we know we have a little more peace of mind and confidence moving into that company if we're new to Medicare. Because in the end, the company that you choose when you start Medicare could be the company that you're with forever, depending on your health status, because changing these plans is not always able to happen depending on your health status. So Medicare Advantage, on the other hand, we can't really go into detail on the benefits because the benefits are different from every company. So we're comparing, in this case, grapes to strawberries to bananas to oranges to pineapples. They're all going to be slightly different. They provide equivalent benefits to what original Medicare would provide. They must have an out-of-pocket limit each year. Most of those plans, again, it's somewhere between $4,000 and $6,700. But they have different doctor networks. They have different drug formularies. And all that can be different. And since those plans are only a year-by-year contract, it can change every year. So if you're shopping Medicare Advantage, you want to really make sure to keep an eye on that every year because you might be happy with your plan now, but next year if they change the doctor network or maybe one of your drugs drops off of their formulary, you don't want to end up with a surprise. And you can change those. Thankfully, you can change Medicare Advantage plans every year if you choose to during the annual enrollment period each fall. So if you have questions, give us a call or send us an email. You can subscribe to our channel here on YouTube or like our page on Facebook, wherever you're watching this video, or just give us a call. And if you want to look at some pricing or plans in your area, or you just have extra questions, you can reach us directly. The toll-free number is listed here on the screen, 866-572-9255. I hope this helps. Thanks for watching, and talk to you soon.